Hey, Terra and Laura. Hey, welcome everybody who is joining us for this edition of Washington University in St. Louis Facebook live discussion. Today we're here with two of our pediatric orthopedic specialists to discuss pediatric injury and injury prevention. So I'm Adam LaBore. I'm chief of the Orthopedic Injury Clinic here. And then we have with us Dr. Laura DePalma and Dr. Terra Blatnik. Laura, if you could say a few words about yourself of introduction.
I'm Laura DePalma. I'm one of the physicians here. I work in both the injury clinic for Washington University, and then I also do some specific pediatric sports medicine and non-operative orthopedic practice as well. And then I also do some team coverage with some of the local colleges.
Thank you. Terra?
Hi, yeah, so I'm Terra Blatnik. I am a pediatric non-operative sports medicine specialist, I would say. I'm primarily out of the specialty care center at Mason and 64, which most people can see right there off of the highway. I do sports injuries, concussions, things like that, and also take care of one of the local high schools in the area.
Great. I just wanted to say to anybody in our audience, if you're participating live, please submit any questions you have in the chat feature, and we'll certainly cover as many as we can here. Well, I'm so excited to talk to you guys. I work more with Laura directly and Terra. We cross paths occasionally with our big department, but also share patients. So excited to have this conversation with you guys. Thanks for joining in. You know, as parents, I think we're all parents and have kids at various stages of development and sports participation and whatnot. But, you know, we're always concerned about injury, you know, what happens if they get injured, what we can do ourselves to take care of them, when to come in, and most importantly, how to prevent it. So we're hoping to cover some of that today with you. One thing I know in the injury clinic that we see come up a lot, and Laura and I have touched on this, is injuries from trampoline use. So, you know, I wanted to get your thoughts as pediatricians and sports specialists on kind of trampolines in general. Go ahead, Laura, maybe you first.
Sure. So this is always the dreaded question from some parents. Like, I'm sure there's a lot of parents out there, you know, there's a lot of kids that have trampolines. As a pediatrician, you know, what I have to say is that we don't recommend it. You know, the American Academy of Pediatrics and the Orthopedic Society, you know, we all discourage the use of recreational trampolines. And so I think the major problem is that the efficacy of some of the studies on the safety just isn't there, and so recreational use is not recommended. That's our take on it, essentially. We tend
Thanks.
to be.
And Tara, are you seeing many related injuries to trampolines? I guess, what are your thoughts?
I will say, admittedly, we have a trampoline at our house. So orthopedists can't have trampolines at their house. We do. It was a pandemic purchase for trying to keep the kids active. You know, even knowing the risks and everything, we were trying to look at some of the benefits. So, you know, there are definitely some benefits. And the reality is that there's a lot of trampolines out there. My kids love it. We have a lot of safety precautions, which we'll talk about, I know, here in a little bit, how to keep them safe at home. But yeah, I mean, the AAP, you know, everybody sort of recommends against trampolines, but reality is they're out there and we just have to figure out ways to make them safe. You know, as I said, we have one at our house, but we work hard to try and make it as safe as we can.
Yeah, and I think that's the one.
That's a great balance.
Oops. I was going to say that's the one.
That's okay. Go ahead, Laura.
Sports medicine is that, you know, even though we may not recommend something, it's also our job to make sure parents are informed of how to make it the safest way possible.
What are some of those ways to make it safe? And I guess Terry, you have one, and Laura, you don't. So I guess Tara, from your perspective as a parent and a physician,
Yeah.
what are some of the safety, features?
Yeah, so I mean, I think our biggest rule at our house, which I think is a good rule for everybody that has a recreational trampoline, is one person at a time. I would say that the majority of the injuries, at least that I see in clinic, are due to two or more kids bouncing at the same time, somebody getting bounced too high, or somebody running into somebody else, or kind of landing awkward, like a littler kid getting bounced by a bigger kid. And so that's really like the number one rule at our house, is one person at a time, because you rarely see, I mean, it can happen for sure 100%, but you rarely see injuries when it's just a kid jumping by themselves, on a trampoline. Unless they're doing kind of crazy flips and things like that. If they're just jumping around by themselves, it's significantly less likely. So that's probably the biggest thing. And then the rest of it's more just safety related, I would say, to the trampoline. So making sure it has a net around it, keeping the kids away from the springs, making sure there's covers, or doing one of the springless trampolines where they're kind of down and that you don't really have contact with the springs. I think those are a couple other things that just come to mind in terms of just trying to keep them safe.
Great. Or does that sound in line with what kind of your guidance to?
Yep, that's exactly what I say. My kids are toddlers or infants, so we're not in that spot yet as far as trampolines. I will say, I loved trampolines when we were growing up, but yeah, exactly what Tara had said is just, one person at a time is a major rule for sure, because you're right. A lot of the kids that actually come through our injury clinic are, I fell and somebody landed on top of me. And so we see a lot of injuries from that. Other things are just, really discouraging flipping and all that kinds of stuff. Obviously, that's riskier behavior. And then I guess just more for maybe at least younger kids, or just kind of active adult participation. So like there's supervision, and some parents think they're just, sitting there watching, but it really should be active, meaning that they're encouraging their kids to not do any flipping, or not doing, that kind of stuff as much as you can.
Cool. Yeah, so you covered that. I was going to ask about, preventing, using it, because they are out there, and preventing injury with it. So it sounds a lot like one at a time, and kind of stay within your abilities. don't overextend it. So if you haven't flipped before, maybe then is not the time to go for it. So on that note of trampoline, and then maybe playground injuries. I don't have a lot of specific things to ask about that, other than, what are some of the things we're seeing, or you're seeing as pediatricians coming from the playgrounds? We'll say, when the pandemic shutdown occurred in the spring, kids were out of school and they were outside early. It seemed that our summer injuries got started early, but last spring. But how about playground? Are there specific things that you see from playgrounds, and prevention strategies around that? Maybe Terry, you can go first this time.
Yeah, so I mean, probably all of us know monkey bars are probably one of the bigger offenders, as well as kind of people trying to slide together down slides. I feel like, for us, it's become common to know, like, don't take your kid in your lap down the slide. But a lot of parents don't realize that, by doing that, if their leg gets caught, all of your weight is going to go into that leg, and that poor little kid is going to end up injuring that leg. So just kind of not doing stuff like that, or even a bigger kid, not necessarily even a parent, but like an older sibling taking a younger sibling down a slide should be discouraged. I think the other thing too is sticking to equipment for the right age group, is not having like the littler kids up on some of the bigger equipment. That can be super dangerous for falls and stuff. Those monkey bars can be really high, or some of those things can be very high, and kind of built for the older, 5 to 10 or 11 or 12-year-olds. When you have like 3 and 4-year-olds on those pieces of equipment, it definitely can get a little bit more dangerous and a little bit more risky in terms of injury.
Great. So when we see the signs, age 10 and under, or 12 and up, it's not just exclusionary. It's this equipment is right for those kids.
Yeah.
Now, one of the things I have a 3, almost 4-year-old, and his major obsession is going up a slide. I don't understand that, but it's just love to do it. But obviously that, kids sliding down, kids going up, that all sets you up for injury. But yes, feet first. That would be another, major thing to sort of help prevent injuries, and all the things that Tara just said as well.
Do you guys see, one of the things that I've noticed, my kids are a little bit older than where you guys are at with yours, but I've noticed as the kids were growing up, playground surfaces improved and equipment improved and that kind of thing. Are there characteristics we should be, looking for in a playground equipment or setup that are favorable for injury prevention?
Yeah, I mean, I think they've definitely moved away from more of the, they've moved away from more of the blacktop type stuff underneath there and have gone more to like wood chip or like the rubber underneath. But I think is definitely better in terms of like, if there is a fall, at least you're landing on like a slightly softer surface. I think I was thinking about that in terms of surfaces and stuff too, is like footwear on the playground. I think, you see a lot of kids in the summertime trying to run around and play in like flip flops and stuff like that. And just, making sure that they're wearing like tennis shoes and stuff at least, because you're less likely to have those falls and things like that off of the equipment if you're wearing good shoes.
Great. What do you think, Laura? Anything different than that? Or?
It's recommended to, as far as the surfaces, should be soft surfaces to sort of absorb a fall or injury or something like that. So yeah, those are kind of the desirable and more recommended playground equipment these days.
In these situations, whether it's playground, trampoline, in the yard, playing in general, and a kid falls down and gets hurt or something happens, are there some, as parents, again, we all know the big red flags of this kid needs to go in, but when it's not so obvious, what are some things parents can look out for to know, well, hey, I can ice this and, ibuprofen, rest and reassure and give it a little time versus, oh, I need to call the pediatrician or get into the injury clinic?
Yeah, so
Either one.
I know. So as far as, when to seek medical attention, I mean, with just general care of injuries, the acronym RICE, right? You RICE your injury. So your rest, ice, compression, elevation, as far as major things to look out for, obviously open wounds, deformities, if it doesn't look right, it looks bent or something like that, that obviously needs, and I'm sure every parent would be a little alarmed if they saw that, but the general care, and then, when it seems a little abnormal would be if, your child, you all know your children, right? And so if they're in, more severe pain, they're, crying uncontrollably, or other things like they're unable to bear weight at all. That would be one thing, right after an injury, they don't want to, but after a little bit, you notice that they really just refuse to bear weight. That's not, that's concerning. Possibly something you should be seen for. And then obviously, maybe some of the older kids would be able to say or describe some sort of numbness in an extremity. That should, you should seek, medical attention for something like that. And then if it's not improving with your normal therapies, your ice and compression and elevation and resting it and trying things like Tylenol and ibuprofen, nothing's working at home, then that would be a time to bring your child in.
Great, thank you. Tara, what do you think?
Yeah, I mean, I think Laura hit, pretty much every point. I mean, I think a lot of it's just knowing your child, and if they're acting out of the ordinary or something that, you just can't console them and can't get them to calm down, or you just can't get their pain under control. I think that's worth at least a trip because sometimes even with something that's kind of simple, if they're having a lot of pain, even just getting some form of immobilization, like a little splint or a brace or something, even just to kind of tide them over until, we could evaluate them or something like that would be just helpful for the kid just to feel better.
Great. Yeah. Some things that stood out to me from what you both said is one, the normal behaviors for a kid. If my kid is really dramatic and reacts highly to everything, well, I can't run into the ER injury clinic or pediatrician every time there's a wolf cried. But if they are moving a joint normally, it's tender, but they'll allow me to touch it. It hurts, but I can walk. Those are all seem to be reassuring signs then.
And one other thing I'd probably make a point is there's a lot of parents that come in, at least through our injury clinic, and it may be a couple days later and they feel terrible that their kiddo had a fracture, a broken bone. And just remember, we're all human and you try what's best for your child and you did bring them in. So, you didn't essentially ignore it and try not to beat yourself up about it. Obviously, you're getting the care you need. So that happens, and understand that. And sometimes the opposite happens. And that's what we're here for, is to reassure that, everything's okay, and that's okay.
Certainly. What kind of segueing from the recreational part of it to a little bit of the sports related stuff. When I asked you all about what to talk about today, part of it was the FIFA 11 and injury prevention, and specifically ACL prevention. So, I thought maybe for our audience, a little bit of an intro what the FIFA 11, like ACL prevention program is about, what it is.
And say, Tara, do you want to take this since you have kiddos in
Oh.
soccer?
Sure. So the FIFA 11 is really a series of exercises. Just to make it basic, it's just a series of exercises that were initially developed for soccer to try and prevent, more specifically, ACL injuries, but it kind of is more of a global injury prevention sort of group of exercises. So a lot of plyometrics, some stretching, some balance, sort of a mix of all of those things to try and improve sort of hip, core, knee strength, things like that. That's going to hopefully prevent sort of more of what we call kind of non-contact injuries. So injuries where things just kind of happen out of nowhere. We can't prevent every ACL injury. Obviously if a kid gets hit or takes, a hit from the side in soccer or football. But these are really to try and prevent some of those things where they kind of make a cut or a turn and prevent ACL injuries that way. So they originally had an adult or a sort of an adolescent version of FIFA 11, the FIFA 11 Plus, and now they actually have a kids version. It's, super kid friendly. They make it really fun. It's kind of a warm up, probably takes about 10 to 15 minutes total to complete. And so, some of the soccer clubs have tried to start, introducing that to try, even at the young ages, to try and do some injury prevention stuff, which I think is great.
Yeah, it is great. Is is the program, I know it's, we can search it online. It's just FIFA FA 11 injury prevention. It's easy. Nothing related to our group or anyone on this stream, if anyone's wondering. But is it, and I appreciate the point of clubs and teams incorporating into their training and their sport prep. Is it a program that parents can kind of introduce with their kids casually? Is it self-instructed as well, pretty easy and to follow?
Yeah, I mean, you can actually just go on if you just Google FIFA 11 Plus, there's lots of good pictures. There's even videos and stuff that you can watch to help you learn how to do it properly. And that's a big thing, is the technique needs to be correct. But there's lots of resources on the website that make it very easy to kind of work through. And so, yeah, even as a parent, for sure, you could work with your kid, 2-3 times a week to run through the program. And it's going to be good for them no matter what, even from just a global sort of strength standpoint. It's also really helpful.
But Terra, do you play soccer then, or?
I do not, but I have two soccer players so far in the family. So we spend a lot of time at the soccer field. So, a lot of experience from the parental side more than anything.
Right. I've got one daughter who does as well. Same thing. No background myself, but following along and learning as we go. So it's great. One of the things that come up both from the physician side and then as a parent from the parent side, we see it happen on the field, are ACL injuries. Even with good training in things like the FIFA 11 program. And there's a gender discrepancy, right? For these injuries as kids grow up.
Yeah, so as far as ACL injuries, females essentially have a larger risk than males for an ACL sort of non-contact injury. So it's about 3 to 4 times, I believe, as far as a higher risk than your male counterparts. And that's kind of a lot of differences in female, the way they're structured, hormonal differences. They've looked at a lot of different things in terms of why, lots of different studies, a lot of it's mixed. But some of it can be modifiable as far as how to prevent it. But that's mainly
Okay. Good. Anything to add to that, Tara?
Yeah, no, I mean, I think, yeah, we do know the girls are at higher risk. So I think especially like in the female, side of the soccer programs, not that males shouldn't do it, they should absolutely, but I think really stressing, trying to do things like the FIFA 11 with those groups is really important for trying to keep those athletes on the field and healthy and away from this ACL stuff, which can be sort of it's an immediate issue, and it can also end up being a long-term issue for them in terms of their sport, in terms of their life, kind of long-term. So we want to try and prevent it as much as we can.
Absolutely. Absolutely. I think we have a question from maybe the audience coming in. With the upcoming change in sports seasons in high school, what types of injuries do you expect to see more of in the next few weeks? I think we've touched on that a little bit before in conversation as well. These kids are, with the situation, particularly, I think this is in line with what this question is getting at. We've had the shutdown of sports through the spring with COVID-19, and then kind of the stutter start stop through the summer. And now, some, at least in our area in St. Louis, we're seeing more widely open sports, particularly in high school. My concern as a physician and parent is kids not having their usual training cycles and season preps, and then going from not fully trained to fully competing. What are your thoughts on that, and specific to this question, what we might expect or what to watch for, and what parents can help their kids kind of prevent as we navigate the rest of this situation?
Yeah, so that's a lot of our concerns and a lot of talk, with COVID. We just don't know a lot, and we're learning as we go. And one of the things that we are thinking about right now are, these kiddos have been sedentary, or they haven't been conditioning or training. And so some of them have shortened seasons, and they're doing more going straight into competition. A lot of the things we're concerned about are injuries, things like ACL injuries, or they just haven't had the conditioning prior to the season that they typically do. So we are, prepared to see possibly increased injuries because of this.
Yeah, I think.
Sorry.
No, go ahead, Tara. Yeah.
Yeah, I was just gonna say, I certainly, especially sort of as sort of things started opening up, I think COVID definitely changed kind of the profile of what we would see. So I think, especially initially, we saw a lot of baseball and softball kind of overuse, like elbow and shoulder thing. At least I did in my clinic. I think because a lot of them went from not doing anything for that long period of time, and then a lot of them were in tournaments within a week or two from just starting out, back into sports, and so their arms and stuff weren't ready. So I think a lot of it's just trying to get athletes to do a slower return, because a lot of them haven't done the things that they would have normally done leading into a season.
And what comes to my mind is making sure that athletes are kind of on a continuous training, even when they're pulled away from teams or competition. Is if it's going to be a stop and start nature of competition, is just kind of always stay prepared and conditioned, and doing your skills training and your basics along the way. And your point about the overhead athletes is well timed. We have another question coming in. Is there a similar program either of you know of to FIFA 11, but for upper extremity and overhead athletes specifically?
I mean, I'd say the throwers 10 is probably
No
kind of
one,
the I guess, semi-comparable sort of thing to the FIFA 11 plus. I think a lot of it is just making sure that the upper extremity athletes are conditioning and doing, like, having an arm care program. I try and stress that a lot with the overhead athletes, especially once they're, and it shouldn't be once they're injured, but it ends up being once they're injured, once I can see them in the office. But just making sure they're year long kind of taking care of that arm and always doing strengthening and things like that throughout the year, so that it's not such an abrupt kind of stop start situation.
right? And then technique too, right? Always making sure there's sound technique is so important with those overhead and throwing, racket sports, volleyball, that kind of thing. Yeah. You mentioned a program, I'm not sure I caught it, for the upper extremity. Is there a training program or plan that you mentioned, Tara?
Yeah, the throwers 10 is kind of just like a basic, like, band sort of strengthening upper extremity exercise series that you can do. We actually have some packets here from our Young Athlete Center with that series of exercises in them that we try and hand out to get some of the throwers to do. I don't know, Laura, do you know of any other specific type stuff?
Probably the main one that I prefer, or just know. Yeah.
Is there a link to this on the pediatric sports webpage for ortho to any, like the throwers 10 or the FIFA 11?
I don't think we have any direct links. I think
something
it's more just, yeah, like if you just Google it, there's lots of stuff on there about it. Yeah.
Oh, good. Just on one last thing I had kind of jotted down to talk about are kind of the overuse injuries, which we're talking around right now anyway. But what are, overuse seems self-explanatory, but in your minds as pediatricians and sports specialists, what are overuse to you? Overuse injuries.
Yeah, so as far as overuse injuries, I mean, there's a whole lot of them that we can ramble off for you, but it's just an imbalance of sort of stress on the body and then your body remodeling, and it should be a nice balance of that. And so when you tip over in either of those, you can develop, an overuse injury, whether it depends on the skeletal maturity of the patient, as far as the kids, but I mean, that's sort of the main kind of like definition, I guess you could say, as far as as far as overuse injury.
Sure. So like training is stressing the body so that it responds, it gets stronger and faster. When we're overriding the body's ability to recover from the training or competing stress, then we start to see breakdown.
Exactly.
In the area. Yeah. Anything you'd add to that, Tara? And then we had another question too. What are your thoughts about PRP treatments for knee or shoulder pain? I haven't fielded this one for kids, but are you guys getting, have you gotten that question?
So personally, I have not gotten that question for kiddos. But as far as adults, people have asked. You might have a better answer than we do as far as that for you, Dr. LaBore. But for kids, I mean, how about you, too, Sarah?
Yeah, I haven't really got not as much for kids.
Yeah.
Yeah, I would say a little bit about the retail's a little ahead of the science on that, on the stem cell and PRP in general. But I would say for kids, my first gut response to that is we got to correct the training, correct the equipment, maybe even match the sport to the kid. Is this the right sport for this kid? And do we need to reset things? That's what I would think of first.
Yeah. So as far as prevention of overuse and everything, correcting your training errors, working with your coaches, your athletic trainers, possibly a physical therapist or conditioning coach or whatever to sort of correct any of those training errors or imbalances, stuff like that. Yeah, would be the preventative part is that we stress for children mainly.
Great. Well, I think we're about out of time. Any last thoughts, Terra?
No, I don't think so. I mean, I think a big thing is just, you know, with like you said, with training stopping and starting, coronavirus has really changed kind of the landscape of sports, you know, in our area and probably everywhere. So just making sure that you're getting, you know, good training in before trying to jump back into too much all at once, just so that you don't get injured. So you can have that season that you've been waiting for.
That's a great end. Well, thank you both so much for joining me. This was fun.
Thanks, Adam.
Thank you.
Absolutely.